Hello, my name is Stephen Denman. My organisation is Shining Guidance. My website is shiningguidance.com. I'm going to talk to you today about the problems with the healthcare industry and how individuals who have autism spectrum disorder or ASD conditions tend to feel very left out and not fully supported by healthcare professionals on many occasions. And this problem applies to pretty much every country on planet Earth to a lesser or greater extent. So we know that, for example, adults that have autism spectrum disorder or ASD conditions do face significant barriers to accessing healthcare, and it's become quite a substantial and ongoing problem for them. Not only are adults with autism spectrum disorder or ASD conditions far more likely to live in some kind of mental health deficiency situation and financial poverty, they're also far less likely to have direct and easy access to quality medical care. They may also face practical barriers such as a lack of transportation to actually attending medical appointments with a general practitioner or GP, and also have a difficulty in navigating a digital based healthcare system, so that being online on the internet by using a personal computer, laptop, tablet, and so forth. And therefore, they will rely far more heavily on verbal communication. But of course, as many of you already know, those individuals who have autism spectrum disorder ASD conditions tend to find using verbal communication as part of their own interskills aptitude to be very difficult and challenging in itself. So, those individuals, for example, who are neurotypical, who do have direct access to healthcare professionals, often discover those healthcare providers, shall we say, are very familiar with their requirements, but any individual who has autism spectrum disorder ASD conditions tends to find that pretty much the same healthcare providers or professionals tend to be rather unfamiliar with their needs, wants, and expectations. And this again adds further challenges to those specific patients who have autism spectrum disorder or ASD conditions actually being given the correct type of medical help and emotional and psychological support that they so desperately need. Whilst each individual who has autism spectrum disorder or ASD conditions has a unique set of needs and requirements, there are some specific types of accommodations that can be easily addressed concerning the very common challenges that are faced by many adults who have autism spectrum disorder or ASD conditions. Now, we know that, for example, that the improvement of access to care for those individuals is a very important thing to be done. So, providing text based communication options is an example because many autistic individuals find it very difficult to use the telephone. We know that some individuals with autism spectrum disorder or ASD conditions also have central auditory processing disorder or CAPD, which is a condition that makes it very difficult to them to process speech. And that obviously affects their interpersonal skills, and this is especially a problem if they're talking over the phone and they have limited internet skills, so therefore they're not computer or digital savvy. Some individuals perhaps are non-speaking or have conditions with where it's a problem for them speaking fluently to strangers. Some individuals with autism spectrum disorder ASD conditions find just using the telephone to be very challenging. They feel embarrassed, they feel insecure, and so again they're limiting their own methods of communication to reach out for medical assistance from healthcare professionals. Text-based options could be used perhaps by healthcare professionals to reach out to individuals with autism spectrum disorder or ASD conditions, using follow-up questions that have to be direct and concise, not vague in any way, of course, and obtaining any test results from those individuals who are autistic can be done this way in a discreet, private, and shall we say, a much more remote interactive manner that makes them feel more secure and confident in their interactions with the healthcare provider they are talking with. We need to remember that healthcare providers can facilitate longer appointment slots, so because many adults with autism spectrum disorder or ASD conditions need additional processing time, particularly when their own communication skills are not at the same level as most neurotypical human beings. and therefore it's difficult for them to actually reach out and express what their actual medical needs and requirements actually are. You know, another use of effective support that could be brought into play by healthcare professionals in terms of communication, is actually setting aside longer medical appointments for those individuals with autism spectrum disorder or ASD conditions who need a slower paced visit. And then healthcare providers can improve their communication with them and ensure that the patient's needs are being addressed in a prompt and timely manner. They feel included, wanted, and needed, and that their own medical requirements are both emotionally and psychologically supported. Perhaps healthcare professionals could provide databases of autistic friendly healthcare providers that within reasonable travelling distance to their own practice. So, within the medical process, there is still a great deal of stigma, misunderstanding, and misinformation about individuals with autism spectrum disorder or ASD conditions. Some healthcare professionals are willing to work with adults with autism spectrum disorder or ASD conditions to make care far more accessible to them, whilst other healthcare providers are far less accommodating and much prefer just dealing with neurotypical patients. So, that in itself is a form of bias, is not particularly positive. So there needs to also be improvements to the quality of care. So visual aids could be used as verbal explanations. Many neurotypical individuals are visual thinkers and prefer to have visuals to support verbal communication. This is also obviously the case with individuals who have autism spectrum disorder, ASD conditions, and it's actually far more the case that they are more visually focused or pictorially focused than neurotypical individuals. Visual aids can be used, for example, as models, photographs, drawings, videos, or other graphics based forms of expression to convey specific medical information by the healthcare provider to any individual who has become their patient, who is displaying the characteristics of autism spectrum disorder, ASD conditions. So this helps to understand the procedures that are needed, the tests that are needed, and the medical requirements that should be met in a timely and prompt and effective way by those healthcare professionals. They should always direct their speech in a concise and clear manner that isn't over complex, and not talking too quickly is also helpful, so that those individuals with autism spectrum disorder, ASD conditions, feel relaxed, able to be receptive enough to receive the kinds of information being given by the caregiver. And so I think, this information I've given is pretty explanatory, really. We have to remember also that individuals who have autism spectrum disorder, ASD conditions, might want to use an augmentative alternative communication or AAC device, such as a tablet or laptop, which they may wish to bring with them to the medical practice if they feel embarrassed about actually just verbally chatting, or they have no confidence, a lack of eye contact, lack of correct body posture and gestures and so forth in the actual practice of the medical assisters that are there as healthcare professionals. So that's interesting that they may be able to use that to help themselves. Communicating in advance by touching the patient is maybe a good idea, and asking their permission to do so. Using tactile sensitivity is really a common sense approach to dealing with individuals with autism spectrum disorder, ASD conditions. So that's important, and that helps reduce their stress and discomfort and being in an alien environment. Certain medications can also affect individuals with autism spectrum disorder, ASD conditions, at a much higher level than, shall we say, neurotypical individuals. This lived experience is backed up by a lot of research on a scientific level, especially in regards to psychotropic drugs that have been used on children who have autism spectrum disorder, ASD conditions. So we know that they do react differently to specific types of pharmaceutical medication as opposed to individuals with neurotypical, characteristics. So we need to remember, if that is the case, that any individual who has autism spectrum disorder or ASD conditions may need lower dosages in order for them to effectively receive that medication in the correct way, so it's not uncomfortable or even unbearable. So I think I've given quite a lot of very useful information here that could be effectively applicated by healthcare professionals when it comes to dealing with individuals who have autism spectrum disorder, and they can use that information to put into best practice a much more effective, interactive, customer service based follow up set of procedures and measures to help those individuals who have autism spectrum disorder, ASD conditions, who may be wanting to reach out to them for medical assistance, and they really need that very prompt and effective emotional and psychological support. They just need somebody to be receptive, understanding, and caring. So on that note, I hope you've enjoyed this video presentation. I've certainly enjoyed giving you this information in this talk. There'll be many more talks to come in the very near future. And on that note, folks, thanks very much for watching, and goodbye.